Yeah, it feels really, really good to give back to my community. It feels good to relate to the youth that I work with, and to be a role model for them in so many ways. Like, it's crazy.
What I would like to do is introduce one of our peer educators, one of our ambassadors, one of our superstars, who's been around with the organization for 5-6 years now. Getting in that set, yeah, starting to sound like me. And so her experience speaks for itself, and she's one of our superstars. She has such a presence and a willing to share, and so I'm honored to bring to the stage Zataunia.
HIV has been a part of my life for it's been like 12 years, a little bit over, it's been like 14 maybe. When my mother disclosed her status to me and my siblings when we were 12 years old. At the time, we were just getting out of foster care. We was in foster care for about 2 years, and we were actually attending a family therapy session. And so I remember the therapist like talking to us about HIV, and she kept asking us, do we know what it is? And we would have conversations about it, which led up to my mother being there and disclosing her status. So even then, at the time, like, we heard about HIV, we knew a little bit about it, and at 12, I mean, I wasn't sexually active, I wasn't even thinking about it. So, you know, I understood it to a certain extent, but then I still didn't understand it. I just knew, like, oh, my mom is dealing with HIV now. You know, I really didn't know what it meant. So fast forward from 12 to, I think I was 16, 17, when I got pregnant in high school, my last year at Savannah County Tech. And it's crazy because I knew about HIV and STIs at a young age. I knew about condoms. My mother's been in the community giving back and teaching others about HIV. So it's not like I didn't know the information. I knew it, but I was a teen, I was young. And that's what happens. You can keep going. So I was pregnant, and I was really involved in a teen parenting program at Washington Hospital Center called TAP. And yeah, it was just something to do, and I was young, and I'm like, I need to learn to be a parent, because you know, this is new to me. But it was during that teen parenting program that MTA, at the time, my supervisor came in with a peer educator to do an HIV one-on-one, and at the time they were looking for new peer educators. So I sat in on an interview, I mean not the interview, but I sat in on a presentation, and of course I knew everything they were saying about HIV and STIs. And then it was time to do interviews, and we did an on-the-spot interview. I filled out the application. Even though my mother suggested that I don't get a job, she wanted me to focus on school and the baby. But I did my own thing anyway. But like literally, I think that was like a Thursday. That Sunday, my supervisor called me and told me that I was hired for the job. And since then, it's been 6 years, like 2008 October, to be exact, that I've been a peer educator at Memphis Needs. And it's crazy because it was just a job. It was literally just a job. I'm like, you know what, I need some money. I need to get it there. You know, forget what my mom would say. But then it turned into so much more, if that makes sense. Because, you know, as a peer, I'm able to relate to people in the community that look like me, that are my age. Even sharing my experience with being a teen parent, like that's not really easy. I'm glad I had a support system to be able to graduate on time from high school and attend college and all that. I will be graduating in May from University. But yeah, so the work I do is really, really important. And over the past couple months, at MTA, I actually was able to do HIV testing for a while, which was new to me, and it was a good experience. I tested, I believe it was 3 positives for the short 6 months that I was on testing. And it was kind of crazy because it was like, again, it was new to me. But to actually disclose the status to someone, it was, you know, I wasn't comfortable initially because I'm like, I don't know what to say. I don't know how to say it. Like, you know, then with the follow-up questions, it was just like, okay, I just want to make sure I'm comfortable and, you know. But yeah, it's just been an awesome experience to like have people come to me for advice as a confidant. come and, pour their hearts out or to ask me for advice and things like that. Yeah, it's just awesome. Just the work I've been doing. Yeah, it feels really, really good to give back to my community. It feels good to relate to the youth that I work with, and to be a role model for them in so many ways. Like, it's crazy. So that they can, be peer educated, even if you're not hired and on a payroll at MTA, like being able to share the correct information and like have these conversations and like you were saying, normalize sex should be a normal kind of conversation. Getting tested should be normal. All of that should be normal. And for me, as it relates to my story, like I wasn't comfortable talking to my partner about condom use, which is why, we started using condoms and then the condoms kind of like disappeared, and even to bring it back up, it was kind of awkward for me at 17 years old. So, that's one of the reasons why I got pregnant. I wasn't talking about condom use. My partner wasn't either, because of course I wasn't, he's not gonna bring it up if I'm not. So yeah, I think it's really, really important, the work that we do at Women Walker, Metro City, and other organizations across the city. We're all in this fight together. So, and it starts with education. Yeah.